afterwards for any students that didn't attend, or for you students that have attended but might want to review what was said. When you registered, you may have put forward a question. We've passed those on to the delegates here today, and if there's anything that crops up during the presentation that you haven't or makes you think of questions, then there will be a time after the presentation where there will be a question and answer where you can put those questions on the chat, and they'll be looked at. So without further ado, I will hand you over to Michelle, and yeah, take things away. Thank you ever so much.
Okay, thank you, Paul. Good afternoon, everybody. I'm Michelle Derry, Professional Development Lead, representing Dudley Group of Hospitals. I'm the pre-registration lead for student nurses, so any students that come into the nursing programme, we support in practice, identifying placement areas and supporting them out in practice throughout their training, whether it's a 3-year programme, 2-year programme or 4-year programme. My colleagues, if I can introduce Rachel.
Hello everybody, my name's Rachel Blower. I also work in the professional development team at Russell's Hall, and I work in the team that are responsible for looking after our support staff, our clinical support workers. So these are unregistered nurses who work on the wards alongside the registered nurses, and they may come in on an apprenticeship route with no care experience at all, or they may have worked in care homes, nursing homes, and come into us that way. We also look after the nurse associates, trainee nurse associates within our team. So this is a reasonably new sort of practitioner. They are registered practitioners in the same way that a registered nurse has a PIN number, and they can do pretty much most things that registered nurses can do. There's a few things that they're unable to do, but they work alongside the registered nurses looking after the patients.
And Kelly?
Hello everybody, my name's Kelly Guest. I work in professional development as well, and I am the support nurse for the registration, so I work alongside Michelle. So my role is predominantly teaching and support sessions and support students throughout their training for the time that they're with us at Dudley.
Okay, thank you. So the process this afternoon, what we'd like to do, we'd like to show you a video, our recruitment video, just to give you a little bit of an insight into working in Russell's Hall and Dudley Group, and then we've got a few slides for a presentation which we'll talk through, and then give you the opportunity to ask any questions other than the one we've got some answers for the questions you've already posted, but any other questions we want to take, we can take then, if that's okay. All right, so if we go into the video now.
Bear with me, I'm just loading that up.
Okay.
I've never loaded a video in before.
Right. No.
Sorry.
I can hear something crackling, but...
Can you see anything, Michelle?
No.
Oh, okay. Bear with me. I'm so sorry. Technical issues. Bear with me. Okay. I'm so sorry.
No, don't worry.
Was it in the folder graduate or recruitment? Sorry, Michelle.
Recruitment and graduates folder, nursing graduates.
That's where I'm in. And then when I'm in there, which one?
Into the recruitment folder.
Yeah, got that.
And it's version 3.
It won't let me see the
It
video.
won't. Okay,
No.
all right, not to worry. Okay, I apologise. We're going to have to abort our idea of showing you the video. Oh,
Hang on.
Oh, sorry.
No, it's okay. I'm just trying to. I've got graduate recruitment event video, but it's not the V3 one for some reason.
Oh, right. No, it should be the V3 one, because that other one's just the presentation with Philippa. Not to worry. We'll leave the video, and if we go to the presentation, and share that with you, and then we can just talk through some how you can get into nursing and healthcare generally.
I'm not doing very well at this, am I?
No, don't worry.
There we go, Michelle.
Oh, have you? Okay, well, maybe be able to get the video up afterwards. If we do the presentation now, is that okay? That's fine. Yeah. Okay, so the next slide. Okay, so when you're considering coming into the NHS, and in particular working for nursing, just to make you aware that there are over 350 different career options in the NHS, not just nursing, obviously, a whole host of opportunities. So what you need to do, or what I would recommend, you consider what you are interested in, and think about whether you want to be working clinical or in an environment of being a doctor, nurse, midwife, dentist, or with the allied health professions, pharmacists, biomedical sciences, psychology, etc., paramedics, and then non-clinical options for the NHS. We also got finance, business and administration, human resources. So one of the areas you could look on is to go to do a careers test on healthcareers.nhs.net. And that's quite a useful link, because it gives you the opportunity to answer questions, and it will come up with some potential areas or career opportunities for you, purely based on what you've put in for your likes and dislikes. We recommend that you also do your research, so attend any open days at the universities, speak to people working in the profession to get their idea of what it's like to be a nurse, because I'm aware that you're very keen about nursing and midwifery in particular. But even if if you want to get some options, I would really speak to a number of people in order to get their advice, to get some information about what it's like to be in that role. And there's lots of, on the internet now, there's lots of information you can source to get that sort of information. Would you like to add anything to that, Kelly or Rachel?
No, I'm fine.
No? Is that okay? Okay.
Yeah, no, the only thing I would say is that there's numerous jobs, and I think I did this event last year, and we actually had the booklet in front of us with all the different career options, and there's many career options even in there that I hadn't necessarily thought of associated with the NHS. So it really is worth having a look on that website for the different options that are available to you.
Yeah, and if you choose to go into nursing, or whatever choice you make, it doesn't just stop there. So once you've got your qualification, you then go on to specialise, and you can become clinical nurse specialist in areas, or diverse, or even do joint qualification. So if you went in to do nursing qualification, you then go on to do midwifery, or if you chose one field of nursing, you can again choose to go and do a top up to become another aspect of that of another field. So there are numerous opportunities. Would you like to look at the next slide, please? So thinking about the qualifications, again, the entry requirements depends on the route and choice of your career. Degree or master's qualifications are required for medicine, dentists, allied professions, nursing, midwifery, require A-levels and a good range of GCSEs, two of which must be maths and English are essential. You can enter some professions via foundation degree route, so that includes nursing. So if you haven't got the A-levels qualification, you can come in via a foundation degree. And also there's the apprenticeship route as well. So that's the clinical route would be nursing. There are apprenticeships in nursing. There's apprenticeships in the nursing trainee nursing associates, and then if you, I know you're having talks next week about apprenticeships, but there's also non-clinical areas such as IT, business administration, and finance, and many more as well. Useful websites would be to look at the Institute for Apprenticeships and Skills for Health, because they will offer a lot of information in relation to careers and career opportunities. Also, gaining work experience is essential and a prerequisite for some professions, and it's desirable for others. But what we would recommend, obviously during COVID, it's been very difficult for work experience to be accessed. I think hopefully moving forward, that should be a better option. But look on websites for individual providers, certainly for Dudley Group. If you went onto our website, www.dgft.nhs.uk, there's a link for apprenticeships and work experience, and it will give you advice how to source that information. We will put that into the chat, so you've got the link for the website. Also, if you want to get work experience in nurseries, nursing homes, residential homes, doing volunteering as well for charities, and volunteering at the trust, they're all very good options for you to get the experience that we require as a prerequisite, and it gives you an insight to actually working in those environments and working with patients, working with other people, and developing your communication skills and your confidence as well. Next slide. Okay, so during your training, many clinical paths have a combination of theory and practice experience. So certainly nursing degrees, it is a 50-50 split. So you work 50% theory in the university, and then you'll have 50% of that your time will be practice experience, working alongside patients on the wards in various areas of practice. You'll be have a practice assessor and practice supervisors. You'll have ourselves to support out in practice, as well as the university will be supporting you as well. There's the opportunity for healthcare courses. You will receive a £5,000 bursary. So although you have to pay a loan to undertake the degree, you do get £5,000 bursary as well. You will work within a multi-professional organisation where teamwork's essential. So you won't just work alongside nurses, you'll work alongside other allied health professions, nurses, clinical support workers, and we all work as a team, all based on delivering that best care for patients. You will learn a host of new skills, not just clinical skills, but other personal skills as well. And you'll be supported to develop professionally and personally. There's excellent career pathways when you qualify. As I say, once you come out with your degree or your master's programme, you can then specialise in specific areas, and it doesn't just stop as being a band 5 staff nurse. You can go off and do other qualifications, and even if you're working within your area, you learn new skills and you specialise. So you may want to focus on diabetes, so you can go off and do a diabetic course, or you may want to look at palliative care and pain management. So there's lots of other things you will learn. In fact, when you complete your degree, that's when your learning starts as a nurse. You never stop learning. I've been nursing for over 40 years. I'm still learning now, although I'm not very good with IT. I do admit. In relation to working for the NHS and working for nursing and healthcare, you have a structured pay scale, and you have paid holidays, plus many other benefits you can access as well. And you will be a valued member of the staff and team within the hospital or private organisation. we are valued. I do feel that we are valued because we try to do our best for the patients, and it is a really rewarding role. It's it's a job I would never have, I'd love to, I would choose to do it again. I'll put it that way. Thank you.
Okay.
And now we'll leave it for any questions. Unless,
do you want me to try the video? Because I've got it on my screen, but I don't think I can share, can I?
If you go across the top and the little up arrow next to the leave button, if you click on there to try and share it that way.
We will attempt.
Oh, yes. Okay. Can you see that?
Oh, yes.
Oh,
that's
good.
Lovely.
Okay, let's hope this is the right version.
Okay.
There's no sound.
Afraid we can't hear anything.
No, oh, we can't hear it, Rachel.
Oh. Any better?
No.
Can you not hear it? Okay. Sorry, I don't know.
Helps if I'm not on mute. We had 4 questions posted previously. So if we go to answer those first, and then if there's any other questions you want to put forward to us. So the first question we had was in relation to work experience and any advice on how to get it and where from, and would help get a work experience. Would help get a work experience placement. So I said you can access the Dudley Group of hospitals and look on our website, and there's information there about work experience. But I would also recommend that you perhaps contact organisations. So looking at nurseries, residential homes and nursing homes, and you will just have to apply to them directly. Either telephone and find out who you should be emailing, or sending a letter with a covering letter with your expressions of why you want to have the work experience always helps. Putting forward to do volunteering. So again, we offer volunteering here at Dudley Group, but there may be other organisations where you can put forward your skills as well. And it really is, I think, in your personal in your information, say why you want the experience, that it is about career progression, about getting the experience prior to following a career path, and to get an insight into support, what is required as part of that post. Would you like to add, is there anything you'd like to add, Kelly or Rachel?
I would just say, I think a lot of, work experience, whatever work experience you can get, just think about the transferable skills that you can gain from that work experience. So thinking along the lines of sort of customer service type roles where you are dealing with members of the public, because all those skills that you'll gain in that kind of a role would be transferable into, working in the NHS. So when you come to apply to universities, maybe for doing nursing courses, make sure you put that down in personal statements, any experience that you've had that you think will benefit your application and can demonstrate that, yeah, I've got these transferable skills.
Yeah, that's fine. So for the next question we had was, how can I get into nursing with children? So obviously, in relation to the nursing degrees, there are 4 fields. So there's adult nursing, child, learning disabilities and mental health. And if you're interested in following a career with child field, then when you apply to the universities, just choose a university that actually offers that field of nursing, and then apply for that application. In order to get supporting experience, again, you could try and get work experience in nurseries, within schools, after school clubs, become volunteers. I can't honestly say that we offer work experience on C2, but that is which is our children's ward. But it wouldn't hurt to just contact the area or look on our website, and it may well give you specific information about getting that experience in that area. Also working any charitable organisations as well, any play schemes, that all gives you the skills of working with children, and sports clubs as well. As Rachel said, you gain transferable skills that will all help with any future career within the nursing field. Is that anything else anybody wants to add? Nope. Okay. The other question we had is it easy to go on to midwifery from nursing? Well, once you've completed your degree in nursing, you can then complete an 18-month shortened programme. But again, you'd have to apply to the university to undertake that further course. Some trusts will offer that up as as a further qualification. So once you're working within the environment, some trusts do offer the opportunity to go off and do your nursing degree as a shortened programme. But it is, that those opportunities are there. There's also direct entry for midwifery as well. So if you didn't want to do the nursing degree, you could go straight into midwifery. And then you've got last question we've got here is, how many kinds of nurses are there? I think there's only one nurse, but there's a variety of specialisms. And as I said, once you choose your career pathway in nursing, whether it be adult, child, learning disabilities or mental health, once you've completed your degree, you can then go off and specialise in a variety of different opportunities. So I mean, we all have, once I qualified as a nurse many years ago, I then went off to do district nursing. So I became a district nurse and did that for many years, and then changed direction and came into education and supporting students myself. So you'll find over a career pathway, you'll have different opportunities. Rachel, I know, had
so I was district nursing, the same as Michelle. So worked in the community setting, so that would be visiting patients in their own homes and providing care for them at home. And then I went into a more public health role and looked at preventative healthcare. So I was working in the hospitals and set up a smoking cessation service for patients who wanted to stop smoking whilst they were in hospital, and provide that support. And then obviously came into education after that. All I'd say is that you keep an open mind, because when you start your training, you might have one idea of a specialty that you think you might like, but then actually when you go into that area as a student, you might then think, actually, no, this isn't for me. But then another area that you perhaps hadn't thought of before then might be something that you are interested in. So always keep an open mind would be my advice.
Mm-hmm.
Yeah, and I came from community as well, so I think the three of us came from community settings, and I really enjoyed community. It was very varied, from looking after our palliative patients to our patients with those long-term conditions. So it's quite quite varied and quite challenging in that sense. And I didn't think I would end up in education, but here I am, and really enjoy supporting students. It is a real privilege to support them through their training, and just to be there to support them. So yeah, I just think there's an abundance of areas that you can go into nursing, and I think that is the beauty of nursing. You haven't got to do just one role. You can go off and do whatever you like. So whether you want to be a diabetes specialist nurse or you want to be an advanced nurse practitioner out in community, you can do anything.
Okay, thank you.
So we've got Louise has asked us, what are the main qualities you need for being a nurse? So, well, I think you need to be caring. You're not going to go and do this role if you're not a caring person. You've got to be compassionate. Okay, and you've got to have a degree of empathy towards patients and understanding, really. It's obviously a very difficult time when patients are coming into hospital, so we need to understand or try and understand what that patient's needs are, you know, being respectful as well of individuals and their needs. Good communication skills are an absolute must, which is why when we talked about transferable skills, communication skills are so important, because you've got communication with the patients, with patients' families, but then also, as Michelle said, you're working as part of a larger multidisciplinary team, so you've got to have those communication skills with other members of the multidisciplinary team as well. Hardworking, yeah, not to be afraid of hard work. Anything else that you think I've missed, Michelle or Kelly?
To be flexible and approachable, and be willing to adapt and learn new things, and to work as a team. And although we say communication is key, it is, but don't think if you're a shy individual and you feel, oh, I wouldn't like that sort of environment where I've got to put myself out there. You learn, you adapt to that, and you develop those skills. Many of us are very shy and retiring, but you learn how to deal with that. So don't let that put you off if you are one of those individuals. You do learn all these skills as you go along.
And a good team is made up of lots of different people. We're not all the same. And, if you have a good team leader that you're working under, your team leader will recognise the strengths of each individual person. And, everybody will have a valuable contribution to make to the running of that team.
And just be aware that you do have to work shifts. So it's not all 9 till 5. It is 7, getting up very early. 12 tends to be 12-hour shifts, and it is a mixture of doing your theory and your practice.
And it's
getting
nights,
that balance. Yeah.
Nights, weekends, bank holidays. So you do have to be prepared.
I think you have to be really passionate. I think you have to really want it, because you are sometimes going to be that person between life and death. You're there to advocate for your patients, for the families, to support them through really difficult and often life-changing illnesses. So you've got to, I think you've got to really want to be a nurse.
Definitely.
Yeah. Okay, any other questions?
Everybody's very quiet.
They are.
Has anybody got questions about anything else other than nursing? So now in previous years we've had questions about other careers, and I mean, if we can help or advise, we would try to, but is there anything related to other NHS type careers?
Nope.
You can say if you want. Oh, you can go on the chat. Is there any advice on how to get into pharmacy? Ooh. Okay, it's a good one, isn't it? I mean, obviously, I would advise that you check the obviously entry requirements for the universities in terms of university courses, which I don't know what they are, but if you're having your sessions with the universities in the coming weeks, they would be able to advise you on that.
Again, work experience.
Work experience, yeah.
if you can get to work, get some experience of working in a pharmacy or a chemist, or there's lots of there's lots of chemists and pharmacies around, so look in your local supermarkets, they often have them attached to them as well, so see if you can go there for volunteering or any work experience with them.
And again, within pharmacies, there's different roles, aren't there? Because you can work as a pharmacy assistant. So if you don't think that going down the university route to going to pharmacy is for you, then you could also look at that option of working as a pharmacy assistant, and it's very much training whilst you're working, and then sort of providing qualifications to work in the pharmacy.
Do we have any other questions from anybody? If we don't, then we'll wrap things up, but I'll just give everybody just a moment just to see if anything else comes up. It's very interesting, and as I put on the group chat there, we actually have a lot of information that we send out to students about work experience opportunities in the healthcare professions, but also we have a lot of information on our Moodle and on our Careers Week information, which is connected on the web as well. So we've got a couple coming through. How long does it take to become specialised in a field such as physiotherapy?
I believe that's a 5-year course, degree program, and then obviously after that you specialise in particular areas that you want to work in. Again, if you go onto the NHS careers website, it will give you specific details of what the entry requirements are, and look at the specific universities that actually deliver that program, and perhaps contact them and look at their open days. But again, there are apprenticeship routes, I believe, going now that are available for the allied health professions as well, that you can access.
I think that we've got some information on our resources connected to the Careers Week on our Moodle that one of our physiotherapist contacts has recorded. So hopefully we can direct all of our students who are here tonight onto that as well for that question. And the other question that's come up, what are the roles of a mental health nurse?
Right.
That's a good question.
Anybody want to answer that? It's about providing support to patients who are going through some clinical need, some crisis. It's offering counselling, support. It could be inpatient care. It could be care in the community. There's lots of areas of mental health that you will come into contact with. So it's looking after the younger person, the older adults, a lot of crisis intervention. I think there's been a lot of information recently about mental health and how we support that. So if you are interested in mental health, our partner trust, which is Black Country Partnership, they provide mental health nursing placements. So if you need a link from them, we can always put you in touch with them. But again, from the university's perspective, if you go to the open days or go on their open days, there will be links with their tutors and practice staff that can give you more advice in relation to that. But mental health comes into acute care as well. So we often have mental health staff that will work within the trust, but also as part of the programme of nursing, all of the fields will experience elements of those other fields, because we have to be able to care for other individuals. So we may, you may have a leg ulcer, but you may suffer from depression as well. So we all have to know how to deal with those patients and those individuals and signpost them to the specialists as and when they're required. So it's not all done in isolation. We all have a little, some input, and be able to signpost to the most appropriate person.
Thank you, that's really helpful. Are there any more questions? I think the discussion that you had around qualities and that to actually, you know, start looking at the professions, but also just doing the research on the range of professions on your website and the other professional websites and the university are really helpful to make students, help students make those choices, and getting that work experience. There are quite a number of virtual work experience opportunities that we've advertised recently, and there's the medic mentors and things for the allied health professionals. So we've advertised all of those out. So I'd encourage students to take a look at the resources that we've put online and the resources you have available on your website as well.
Okay. Thank you.
If there are no more questions, can I just say to students that we will put this recording onto the Careers Week live webinar sort of list, and so you can go and access this again. And if you have any further questions, perhaps we could take those questions to the careers@keds.ac.uk website and forward those on, and then perhaps we could ask Kelly, Rachel and Michelle to respond to those via ourselves.
Yes, that's fine.
Is that all right?
Yes, that's fine. Thank you.
So can I just thank you all very, very much indeed for helping this evening enlighten our students, and thanks to the students for attending. We hope you'll attend the Apprenticeship Week webinars next week, and then we've got our HE Week, which of course there will be a number of relevant information, resources and live webinars on that too. Thank you very much indeed, everybody, and we hope that next year we'll be doing something perhaps a little different. Thank you very much.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye-bye.